Lele malo taulava talufalava kiorana whakalofala ya Tunisa pulaminaka and more Pacific greetings to all our listeners and viewers this afternoon. Thank you so much for tuning in. Joining me on the Pacific Health Talanoa today is Dr. Richard Hulme, Clinical Quality Director and Continuing Medical Education for Tamaki Health. We'll talk about the vaccine, the Pfizer vaccine. Richard is one of the very, very first New Zealanders to get vaccinated. Welcome on the show, Richard.
Talanoa, Lorenzo. Thanks for having me on.
Thank you so much for taking the time out of your busy schedule to have a Talanoa with me about the vaccine. Now, Richard, with all the misinformation, and which obviously causes confusion and anxiety amongst our Pacific community, what would you like to say to our people?
Look, I think a lot of people are scared because they're not really sure, or they've been told stories, and we just want to really encourage people to get vaccinated because one dose will save your life. 2 doses will keep you out of the ICU in the hospital. So, think of not only yourself, but think of your loved ones, think of the people you want to protect, because certainly having the vaccine helps to prevent you from passing it on to other people. And we've heard of so many cases where someone has got the virus, but that they're living with their older parents, and we want to protect them, right? So we have to think about those who are most at risk, and our older patients or our loved ones are precious to us, so we need to protect them, and one way we can do that is to have the vaccine ourselves.
Thank you, Richard. And some of our people are still confused about the difference, between the Delta virus and the first, wave of COVID-19. Can you explain the difference? And can you explain that for us, please, Richard?
Sure. So what we know about Delta is that it's way more infectious than the old virus. So the old one, or the first one, was called Alpha. The latest one is called Delta. And because Delta is way more infectious than the Alpha, it's now the most common variant around the world. So it tends to, it's more infectious. So like if we were to liken the Alpha virus to like catching a cold, this one is like catching chickenpox. So in other words, more people can get infected more easily with the Delta strain. And so it tends to not only pass on more easily, but it also lasts longer, right? So people can be infectious for a lot longer, and that obviously affects how long we have the isolation periods for, if someone's in quarantine, or someone has to stay in isolation if they think they've been a contact of someone who's been a close contact. So that's why we had always advise, listen to the advice from Healthline, your public health, that you're being given as to what's the risk to you if you've been in an area where there's been someone that's positive, and how long should you stay in isolation for. I think that's probably one of the things that causes a lot of confusion, is sort of like, what do I do? Should I get tested? Should I get vaccinated? Those are all the questions that our people are sort of wondering about at the moment. But I think the thing that we really want to get people, we're doing really well, right? That's the first thing I want to say, is that we're doing really well. So we're seeing a lot of our Pacifica people getting immunized, more so than Māori. So we're doing really well. And we just really want to encourage people to get vaccinated. Don't be scared. And it's natural to be scared. But honestly, once you've had your first shot, you'll say, oh, what was I scared for? I thought it was going to hurt or something like that. But, everyone is different in terms of what side effects they can experience, right? So if you've ever had the flu vaccine before, influenza vaccine, some people might feel tired, some people might not, Some people don't notice anything except for maybe a mild sore arm, but everybody's different. But by and large, we want to reassure people that millions of doses of the vaccine have been given around the world. If we look at Australia, for example, there's more than one type of vaccine that's been made available. The one in New Zealand, of course, is called the Pfizer vaccine. But the one in Australia that they first started with was AstraZeneca. And the problem that we saw with the AstraZeneca vaccine was some people had problems with clotting. And that obviously is very serious. So that put a lot of Australians off having the vaccine. And people sort of think, oh, maybe I better not have the vaccine. This is people in New Zealand sort of thinking, maybe I better not have the vaccine. I don't want to clot. But the good news is that the Pfizer vaccine doesn't have that problem. And so a lot of Australians were waiting for the Pfizer vaccine to come to Australia before they got vaccinated. So we're lucky in New Zealand that we've got a very smart prime minister who said, hey, we're getting Pfizer, all right? We're getting the best one, all right? And so I want to encourage people as much as possible to not be scared, to get the vaccine. We've got the best one of all the available vaccines, and a new lot just arrived from Spain this morning, as you probably heard. Auckland is the area that is the highest risk. And as you know also, they're talking about vaccine passports one day when people want to travel, right? And if you're thinking about going back home one day, whether it be to Samoa, to Tonga, or wherever, one thing that you're going to be asked about is, have you got your vaccine passport? Because if you don't, we don't want to see you, right? So think about those things in the future. You know, you need to have two doses of vaccine, as I say, to be fully protected. And if you're thinking of wanting to go back home one day when the bubbles are open, think about your vaccine passport and getting those 2 doses of vaccine so that you can go back home, because we all miss going back home. I miss Samoa. I want to go back and see my auntie and my family over there. I can't wait, you know, but we have to wait until it's safe to travel again.
Dr. Richard, another common question that our people are asking, and it's good to have you on the show today as a clinical director, is what is in the vaccine? What chemicals are in the vaccine? If you can simply explain that for us, please, Richard.
Sure. Well, look, the bad stories that were going around at the beginning was that, hey, this is an experiment, right? This is sort of like, you know, it's how can they make it so quickly? It's just an experiment, right? How are they experimenting on us? Are we a guinea pig? Sort of thing, you know, that was the kind of talk that was going around at the beginning. But for those that know, we know that this technology has actually been around for a while. And one of the reasons why they were able to make the vaccine so quickly was that the technology has been around for a while. So it's just really like making a flu vaccine. You know, the flu vaccine changes every year because around the world, the different variants of the flu change, right? So the Northern Hemisphere viruses change. And so when we get the vaccine in New Zealand, we have to take into consideration what's going on around the world. So it's going to come to us, right? So to come back to the question again, is that this technology of making vaccines is not new technology. It's been around for a while. So when it came to making the COVID vaccine, it was very quickly made, you know. So we're very lucky, really, that it was able to be made so quickly because as we've seen overseas, like in the UK and in Australia, they missed the boat. They didn't get enough people. They didn't keep their borders, didn't get their borders closed as quickly as what New Zealand did. And as a result, now they can't keep up with the spread of the virus in the community. So their strategy is, okay, we can't go with what they call elimination strategy. In other words, keeping it out. They have to go with getting as many people vaccinated as possible. And you probably heard in Sydney, they're talking about having a Freedom Day, like they had a Freedom Day in the UK. And that day is going to happen when they get most of the population vaccinated, all right? So now we're very lucky in New Zealand that we're heading towards total elimination again, and that we'll hopefully have our freedoms back again like what we used to know before.
Thank you so much, Dr. Richard. The other question that our people are asking me is, and I guess this is one reason why they are scared to go and get vaccinated, is some of our people are overstaying in New Zealand and are here on temporary visas. Is the vaccine for everyone, or is it specifically for New Zealanders?
No, the good news is for everybody in New Zealand. Doesn't matter, you don't have to produce a passport. Doesn't matter if you're overstaying or not. If you need to be protected, you won't be asked for any ID, right? So you can say, look, I don't need to produce the ID. I'm here for the vaccine.
And with your work as a GP, Dr. Richard, and I know you moved from one clinic to others. What is the response like, from from our people in terms of coming in to see GP practices?
Yeah, look, our general practices are quiet now because people are scared. We know that even the latest case at Middlemore Hospital, where someone came into the hospital, they didn't have any symptoms, so they were well, but they had a swab done just to make sure they were safe to come into the hospital, and then they chose to leave the hospital. So even though they had no symptoms and were well, their test came back positive, and therefore he's affected. I think it was a he, I'm not sure, affected anybody else that was in the waiting room in the emergency department. So people are scared to come into general practice because they're worried about the same problem happening to them. Why, if I am well, do I want to go to the GP and potentially get something, right? So they're naturally staying away and only coming in if they're really sick. But I think the advice I would have is that if you are coming into the GP, wear a mask, protect yourself, because you don't know who's got it. Because even people who don't have symptoms can have the virus, all right? Which is why the government's now saying we want to test people not only with symptoms, not only who's crossing the border between Auckland and outside of Auckland, but we're also interested to swab, people who don't have symptoms, particularly the essential workers.
Thanks, Dr. Richard. And what are some of the things, simple things that our families and our ainga and our community can do at home to make sure that they are, they're keeping themselves active and they're looking after their holistic health and well-being?
It's a good question. I think that stay in touch with everybody, all right? So that's the first thing. Just check in on your relatives to make sure they're okay. Particularly some people who are lonely. We want to make sure that they don't feel too isolated. And we know some people who live alone are feeling that way. They can't get out because of the lockdown. So stay in touch with your ainga, your family. I think that you can always do exercise, all right? Walking, that sort of thing. There's nothing to stop you from getting out of your house because, when you stay indoors all the time, you do get a bit of cabin fever, eh? Sort of feeling like, not the cabin bread, Lorenzo, that's cabin fever, all right? You sometimes you feel like you're a prisoner in your own home, right? So you do have to get out and go for a walk, and just make sure that if you're going out for a walk, I would advise you to keep your mask on because you never know. I mean, this virus is so catchy that you just have to walk past somebody and you can catch something, all right? The risk is obviously low with the low community transmission that we're seeing, but I think that better to be safe than sorry. Take a mask, all right? And so I think the mental well-being is just as important as the physical well-being, and I think one of the things from the mental well-being point of view is getting out of the house. When it's not raining, of course. But it's good to get outside of the house, get some fresh air, and but don't forget we've got music, so you can do your little boogie in your house and just have a dance. Music is always good for the soul, right? So, it's a challenge, obviously, that people can't go to church and congregate and listen to the sermon, but I'm sure the churches have got a lot of things that they're doing. They've been through this before and know how to do online sermons and the meetings and so forth. So staying in touch is so important. But don't forget about your family. Don't forget about your mental well-being, and doing what makes you happy and gives you joy. And the other thing is just be careful about your eating. You can put on too much weight in this COVID. Often we talk about COVID babies and COVID twins and so forth, because it's easy to put on weight just living off chips and not exercising much. So just have to be careful about your general health and well-being, and contact your doctor if you need a prescription for your medication. They can arrange that for you so that you can just pick it up from the chemist. You don't have to go into the doctor's surgery, and that way you can carry on with your medication. And those sort of things will keep you healthy. So staying on your medications, our relationship with God's important. So obviously keep praying and praying for all those people who are affected, praying to stay well and praying for others, and those who are really struggling because, they're not able to go to work. There's a lot of people who are really suffering out there. So, so I think just be kind. The other things, be kind, because when everyone gets locked up like this, they get on each other's nerves sometimes, and it's easy for everyone to lose the temper. So try to be kind, and I think if we do those things, we don't have long to go now. But we've been through nearly a month now in Auckland, so let's see what happens, and hopefully we'll come out of lockdown soon.
Thank you so much, Dr. Richard. And lastly, what would be your message for our community who are, about the importance of the vaccination? Richard.
Well, as I've said to you before, you're thinking about not just protecting yourself, you're thinking about protecting your loved ones. Those that we're seeing with the Delta variant that is affecting people of all ages, from young babies all the way up. No one is immune, right? Interesting, when the first case broke out in New Zealand, the man got the virus, but his wife was vaccinated and she didn't get a positive test, right? Now, some people can have the vaccine and get a positive test still, but they're not as sick as those who have not had any vaccine, and certainly they won't end up in hospital, right? So the vaccine saves lives and can keep you, a lot of our people are overweight or at risk, right, for so many different health reasons. So, we have to remember that, we all play an important role in our family, right, and our extended family. And so let's do the best that we can to stay healthy. And, obviously, there are a lot of people that are suffering. I listened to the story the other night of the man that was in MIQ who couldn't get anybody to listen to him, but he was feeling sick, and I'm glad that he eventually called the ambulance himself and got seen. But I think if you're worried about anything, phone Healthline, phone your doctor. If you're really worried about shortness of breath, or if you think that you might have some symptoms, call Healthline, right? And if you think that you've had a positive test and haven't heard from Auckland Regional Public Health for whatever reason, contact your doctor, and then they can contact Auckland Regional Public Health to contact you. Because, we have had situations where some mix-up happen and then people not get contacted, who should be going to a managed isolation facility. So don't be afraid to reach out. We're not going to be punished, right? We want you to be safe. We want you to not be scared, right? So this thing, my take-home message, if you haven't been vaccinated, get vaccinated. If you think you've got symptoms, get tested, and just follow the rules, and then you'll be fine. And don't forget to scan your QR code, right? Those sort of funny looking pictures you see on the shops. Scan where you've been, because that way they'll know who else has been potentially affected. Or if you've been shopping somewhere, then they can contact you to let you know, hey, someone was positive, went to your supermarket. Watch out for any symptoms, all right? So scanning is really important, all right? And not a lot of people are scanning. It's now compulsory, obviously, because we want to catch it. But I think, our people have been really affected quite badly this outbreak. South Auckland's been hit hard. I'm just glad that there's nothing like that happening in Samoa or Tonga or Niue, and all the other Pacific Islands, except for, unfortunately, Fiji. But, we have a responsibility to protect our loved ones back home as well. And as I say, don't forget, thinking about one day the vaccine passport. You want to make sure you get your vaccine passport.
Thank you so much, Dr. Richard. Me taki maata, minaka vakalevu malo opito, and a big whaatai te lava for coming on a Talanoa this afternoon. Thank you so much for your time, Dr. Richard.
Te awhaina. Whāsoifua.
Whāsoifua. Aotearoa, we are a team of 5 million. And remember, the virus is the problem, not the people. Be kind and stay safe. Tō whāsoifua.
Squad, baby. Rex, J. Sands.
Let's go.
Oh, say I'm say you are complete to me, I get you. By the way that you move and the way that you smile. Say, oh my Dorima, baby, you be giving your hand, I'll take you anywhere. You give me something that I never had. Cause you care, but about to me and the family. Say, why you waiting on me to talk to you? Yeah, I'ma listen what y'all say. Yeah, don't move out in the come here. Yeah, they on the layout, oh, dirty wine, girl, dirty wine. Yeah, say, I'm in and not the fight to get out. Say,